We are live now. I request your session
Okay.
permission to start with the session, ma'am.
Yes. Start.
Thank you, ma'am. Hari Om, everyone. A warm and heartfelt welcome to the 30th session of Higher Anatomy, a prestigious lecture series designed exclusively for the first year BMS students, and we are delighted to have you all here today. But before we embark on this enlightening journey, let me take a moment to introduce you to Jignasa, a pan-India platform driven by the student community of Bharata within the Ayush fraternity. Created by ABBP in the year 1998, our motto is simple yet powerful. Learn Aish to practice Aish. We strive to empower Aish students from campuses to communities, bridging the gap between students, policymakers, and administrative authorities. Jignasa serves as a unifying force connecting every aspect of Aish, including students, academicians, practitioners, scientists, industrialists, and hospitals, all under one inclusive umbrella. We firmly believe in thinking globally while acting locally, working tirelessly over the past 2 decades to strengthen the Irish education system and instill confidence among Irish students. To achieve our goals, Jignasa has undertaken various impactful initiatives across the country, ranging from grassroots to international platforms, and some of our key initiatives include study circles, lecture series on specific topics, free medical camps, social health status surveys, hands-on training workshops, conferences, national and international level, interaction with eminent Vaidyas and academicians, brainstorming sessions to engage with high stalwarts, policymakers, and key stakeholders, National Arogya Expo and International Conference, national level seminars, medicinal plant visits exploring the rich diversity of medicinal plants, pharmaceutical visits, agitations for the I students community advocating for the rights and demands of I students, private internship program facilitating a hands-on learning experience under the guidance of acharyas, interaction with traditional healers, learning from the wisdom and expertise of traditional healers, online mock test, social awareness campaign promoting various concepts of ICE system for societal well-being like Swarna Bindu Prashana Camp, Ashtashotottari Yoga, and many more. Free healthcare assistance during natural calamities and accidents through local governing bodies was also provided by our organization. In our last session, it was a testament to the overwhelming response and enthusiasm from students. With over 700 live participants and more than 18,000 views so far, we are humbled by your active engagement and dedication to learning. At Jignasa, we understand the financial challenges that many students face when it comes to accessing commercial study platforms. We firmly believe that education should be accessible to all regardless of their financial constraints. Hence, we are committed to providing a helping hand to every student fueled by the burning desire to learn. With the support of the experts in the field, we offer you the opportunity to learn anatomy with no financial burden. And all we ask for is your unwavering interest and passion for the knowledge. Today, we are honored to have Dr. Priyanka P. Shavpur ma'am with us, BMSMD Associate Professor Rachana Sharira in Tapavana Ayurvedic Medical College and Hospital, Davangere. Ma'am completed her UG from Ayurveda Mahavidyalaya Hubballi, Karnataka and MD from SDM College of Ayurveda Udupi. Ma'am was a university topper who got 6th rank in MD examinations in Rachana Sharira of RGHS. Ma'am has co-authored for the book textbook for research methodology and statistics in Ayurveda for UG students along with Dr. Rashmi Pujar and Dr. Ashwin Haridas. Ma'am has participated in numerous in national and international seminars and workshops. Ma'am has published articles based on a variant branching pattern of axillary and brachial arteries, anomalies, a case for infertility, WSE ebook publications. Ma'am is currently pursuing PhD in Department of Rachana Sharira from Parul University, Gujarat. Ma'am is also presently working as Associate Professor in the Department of Sharira Rachana in Tapavana Ayurvedic Medical College and Hospital, Davangere. Ma'am, we are delighted to have you on the session today, ma'am, and we extend our warmest welcome to you and to each and everyone who are watching this session. We hope you find this session helpful. Ma'am, now I request you to carry this session forward.
Okay. Thank you, Karthik, for warm welcome. Good afternoon, everyone. So today we are going to engage on the topic myology. So basically, in the myology, in your syllabus according to NCISM, it is for 4 marks. Along with Kesha, Nakadanta, and Peshi, completely it comes for 11 marks. And most probably questions like short questions and MCQs may come from the myology part. Next, next slide. Next slide. So coming to introduction to the myology. So along with the skeletal framework, even the muscles also are helpful for the building the framework of the body, and along with that it has important contribution towards the movement of our body. So for by doing contraction and relaxation of the muscles, so mainly for the locomotory function, the muscles contribute more, and out of our total body weight, 40 to 50% of the body weight is contributed by the muscles. So before going to the actual all the muscular system, so let us know about what is muscle. Next slide. So what is muscle tissue? So as you all know, tissue is a group of cells. So muscular tissue is also a group of cells, which their cells are called as myocytes. So basically, this muscle word is derived from the Latin word that is mus, which means mouse. The resemblance of the structure of the muscle is like mouse, so it is derived from the word mus. And these myocytes, they are elongated in one direction. Therefore, sometimes they are also called as muscle fiber. So they are basically mesodermal in origin, and they are having main myofibril components, proteins like actin and myosin, which are responsible for the contraction and the relaxation of muscle fibers. And some cellular components which are named differently from basic cell are: the plasma membrane of the muscle tissue is called as sarcolemma, cytoplasm is called as sarcoplasm, and smooth endoplasmic reticulum is called as sarcoplasmic reticulum, and mitochondria is as sarcosome. Next. So coming to types of the muscle tissue, so there are mainly three types: skeletal muscle, cardiac muscle, and smooth muscle. So skeletal muscle, they are throughout the peripheral body, that is through all the skeletal system. And cardiac muscle and smooth muscles, they are involuntary, and cardiac muscle refers to the heart muscles, and smooth muscles mainly present in the viscera. Next. So skeletal muscles. So skeletal muscles mainly they are responsible for the locomotion. So when you see under the microscope, so you are going to see the transverse striations. You can see in the image. Therefore, they are also called as voluntary muscles. So length of the fiber in the skeletal muscle is variable depending upon the region they are present, and nuclei are elongated and they are present in the periphery, whereas cytoplasm is filled with numerous longitudinal fibrils. They are called as myofibrils. And because of presence of transverse striations, it forms light and dark bands. So the dark bands are also called as A bands, that is anisotropic, and I bands, light bands are also called as I bands, that is isotropic bands. Next. So how this organization of the skeletal muscle is there? So mainly the bundles, all the muscle fibers, they are arranged in the form of bundles, that is called as fasciculi. So each myofibril, it is surrounded by connective tissue that is called as endomysium, and the individual fasciculi, that is group of myofibrils, forms fasciculi. So that is covered by the perimysium, and the entire muscle is surrounded by connective tissue that is called as epimysium. Next. So in the image you can see the single muscle fiber, fasciculus, and entire muscle covered by the connective tissues. And next, going to microscopic structure. So in each muscle fiber, so you will find dark and light bands. So in the middle of each light band, that is I band, there is a thin dark line that is called as Z line. So in the light band, you can see light thin line which is Z band, and in the middle of A band, it is traversed by lighter band that is called as H band, and in the middle of the H band you can see the dark line, thick line that is called as M band, and the consecutive Z bands in between two consecutive Z bands that is called as sarcomere. So in next image, next slide. So in this image you can see the A band, dark band, and light band, I band. So in between, in the center of the I band, you can see zigzag line that is Z line or the Z band, and in between, in the middle of the A band, you can see M band, and H zone in the, and two consecutive Z band. It forms the sarcomere, and also the structure of actin and myosin. So myosin having head, neck, and tail, and actin having tropomyosin and troponin filaments. So these head attachment of head to the troponin and tropomyosin forms the contraction and relaxation of the muscle. Next. So these are some of the shapes and different architecture of the muscles which are present in the body. So, like quadrilateral strap muscles, strap with tendinous like in the abdominal muscles, fusiform shape that is normal all the muscles, and digastric having two bellies, and tricipital having three origins, triangular, cruciate having crisscross, and twisted, spiral, multipinnate having multiple origins, bipinnate having two origins, and unipinnate having one origin. Next. So in the skeletal muscle, you will observe muscle spindle. The muscle spindle is nothing but it is a spindle shaped sensory end organ which is located within the striated muscle. So the afferent, you can see in the image, afferent nerve endings, they are surrounded to the spindle like spindle shaped muscle fiber. So it forms it is mainly responsible for the sensory activity of the muscle, sensory action. Next. And innervation of blood vessels and lymphatics, that is called as neuromuscular hilus, where through that all the nerve vessels and lymph vessels they enter the muscular tissue. Next. So next is motor end plate. So you can observe in the image one soul plate like ending in the periphery of the muscular tissue. So that is the neuromuscular junction. That is the motor end plate. That is motor nerve endings which supply to the muscular tissue. Next. So this is about skeletal muscles. Next is cardiac muscle. So cardiac muscle and smooth muscles are involuntary, and the cardiac muscle, it is innervated by autonomic nervous fibers. So some similarities are there in cardiac and striated. Like in the striated muscles, here also elongated muscle fibers are there and transverse striations are there, and it also contains A, I, Z, and H bands, and it also has actin and myosin filaments. Next. So in the image you can see the striations and all. And some differences are as like in the skeletal muscles, it is not multi nucleated. It is having single nucleus in the um one cardiac cell, and nucleus is present centrally. Whereas in between two consecutive nucleus, you can see the zigzag like attached intercalated disc, zigzag like, so that is called as intercalated disc. And sarcoplasm is abundant, and numerous mitochondria are present because cardiac muscle needs more energy. It is having uh, there is no rest, so continuous work, so it has numerous mitochondria and centrally placed nucleus. So these are the features of cardiac muscle. Next. Next, coming to smooth muscles. Smooth muscles, they are non-striated. Both the cardiac and striated muscles are having striations, but here it is non-striated, involuntary in action, and they are also called as plain muscles. So it is made up of long spindle-shaped cells having oval nucleus or sometimes elongated, which is placed in the central part of the cell. And sarcoplasm is indistinct, longitudinal striations. So there you observe transverse striations, whereas in the smooth muscles you have longitudinal striations. Next slide. So in this image you can observe the longitudinal striations, myofilaments having actin and myosin, but the actin doesn't contain troponin filament and devoid of troponin. Next. So you'll find these smooth muscles in the walls of hollow all the viscera, hollow of the all the viscera, and narrow tubes of the tubular structures of the body, pupil, and in the orbit, the skin of the scrotum, and in relation to hair follicles. So they are innervated by autonomic nervous system and have arranged into distinct layers, that is inner circular and outer longitudinal. And sometimes it may have three layers in some regions like urinary bladder and all, circular layer of the smooth muscle. Next. And next, myoepithelial cells. These are mainly present in the glandular structures where it shows contractile proteins like actin and myosin. For example, in case of mammary gland and salivary gland. So myoepithelial cells are there. So they present in relation to secretory elements for the secretion of the ductus juices. Next. So this is regarding the basic about the muscle tissue. So next we'll move to the muscles, skeletal muscles of the body. So starting with the muscles of the upper limb. Next. So in the upper limb, muscles connecting to the anterior aspect of the thoracic region, that is pectoral region muscles, and then arm muscles, scapular, back and forearm muscles, and hand muscles. So coming to first pectoral region muscles. So there are mainly three muscles: pectoralis major, minor, and subclavius. Pectoralis major muscle can be asked for 5 marks individually, or the whole region pectoral muscles are maybe asked for 5 marks. So pectoralis major muscle mainly it originates from anterior surface of medial two-third of the clavicle and anterior surface of the manubrium sterni, second to sixth costal cartilages, and sternal end of the sixth rib, and aponeurosis of external oblique muscle, the abdomen. And it inserts into bilaminar as a bilaminar tendon into the lateral lip of the bicipital groove, forming into two laminae, anterior lamina and posterior lamina. And pectoralis minor arises from 3, 4, 5 ribs and intervening fascia, external covering the external intercostal muscles, and it ends in the medial border and upper surface of the coracoid process. And first rib, subclavius, it arises from the first rib at the costochondral junction and ends at the subclavian groove in the middle one third from the first rib to the clavicle. So it's subclavius. Next slide. So pectoralis major muscle, major and minor both are supplied by the medial and lateral pectoral nerves. And actions of pectoralis major it acts as a adduction and medial rotator of the shoulder joint, whereas clavicular part it produces flexion of the arm and extension of flexed arm against the resistance. It draws the scapula forwards along with the serratus anterior and depresses the point of the shoulder. Sorry. So pectoralis minor draws the scapula forward and depresses the point of the shoulder. And subclavius, it steadies the clavicle during the movement of the shoulder joint. Next. So in the pectoral, in the image, you can see the pectoralis major muscle having clavicular manubrial fibers, sternal and aponeurotic fibers. So clavicular and manubrial fibers, they form anterior lip, and sternocostal and aponeurotic fibers, they form posterior. They form bilaminar tendon and inserted into the lateral lip of the bicipital groove. Next slide. Serratus anterior muscle. It is also called as boxer's muscle or swimmer's muscle. So serratus anterior muscle can also be asked for 5 marks, and the another names of these this serratus anterior for MCQs they may ask which is boxer's muscle or swimmer's muscle. So origin of serratus anterior is 8 digitations from the upper 8 ribs in the mid-axillary plane from the fascia covering the intervening intercostal muscles, and it is inserted into the costal surface of the scapula along its medial border. Nerve supply is nerve to the serratus anterior, and actions along with the pectoralis minor, it pulls the scapula forwards around the chest wall, and fibers in the inferior angle from the inferior angle of the scapula they pull forward and rotate the scapula, whereas And this muscle, it steadies the scapula during weight carrying. Whenever we are carrying the weight, so it steadies the scapula, and it also helps in the forced inspiration. So next slide. So in the image you can see serratus anterior muscle originating from the 8 digitations and inserting into the medial border of the scapula. Next. So next, the back muscles which are connecting to the upper limb. So the mainly trapezius, latissimus dorsi, rhomboides major and minor, and levator scapulae muscles are there. So here you can see trapezius muscle. Trapezius and latissimus dorsi can be asked for 5 marks. They are very important muscles. Next slide. So trapezius, it arises from the medial 1/3 of superior nuchal line, external occipital protuberance, ligamentum nuchae, C7 spine, T1 to T12 spines, and corresponding supraspinatus ligaments. And ends at the upper fibers, they insert in the lateral 1/3 of the clavicle, whereas middle fibers to the upper lip of the crest of the spine of the scapula, and lower fibers on the apex of the triangular area on the medial end of the spine. So it is having right and left part. So whole together it is diamond shaped. That is why it is a trapezium, which covers almost upper half of the back. So next is latissimus dorsi muscle. It covers most large area of the lower back. So it is the main which connects the pelvic girdle and vertebral column to the upper limb. So it originates from posterior 1/3 of the outer lip of the iliac crest and posterior layer of lumbar fascia, spines of T7 to T12, and inferior angle of the scapula. And it inserted into the in between the teres major and pectoralis major, that is in the bicipital groove, the floor of the bicipital groove. So that is one mnemonic is that lady between two majors, that is pectoralis major in the lateral lip and teres major in the medial lip, whereas latissimus dorsi in the floor of the bicipital groove. Next. So trapezius muscle, it is having innervation of spinal part of accessory nerve. It is the only muscle which gets cranial, the skeletal muscle which gets part of supply from the cranial nerve, that is spinal accessory nerve, and also from the branches from C3 to C4 spinal nerves. So coming to actions of trapezius, the upper fibers, they are along with the levator scapulae, they elevate the scapula like in shrugging, and middle fibers, they act with the rhomboids major and minor to retract the scapula, whereas upper and lower fibers along with serratus anterior, they rotate the scapula forwards towards the chest wall, and it also steadies the scapula. And latissimus dorsi, it is supplied by the thoracodorsal nerve, which is a branch of brachial plexus. So it helps in the adduction, extension, and medial rotation of the shoulder, like in swimming and climbing. And also this is also called as climbing muscle, So it is the main muscle which is used for the climbing and scratching, also scratching your opposite side of the scapula. So this type of other names, climbing muscle or scratching muscle, so they can be asked for MCQs, which is climbing muscle or which is scratching muscle and all. And it also helpful in the expiratory, forceful expiratory uh, functions like coughing and sneezing. And it is also responsible for holding the scapula in place. Mainly, it holds the inferior angle. Levator scapulae muscle, it elevates the scapula, and rhomboid major and minor, they help in the retraction of the scapula. So in this area, you can also observe uh, auscultation area, triangle of auscultation, that is in between trapezius muscle and rhomboidus, trapezius muscle and latissimus dorsi, and laterally scapula, and floor is formed by the rhomboidus major muscle. So that is the only place where in the posterior aspect it is not covered by larger muscles, so you can hear the sounds. So triangle of auscultation in the back region for the examination. Next. And the muscular spaces like axilla and cubital fossa in the upper limb, they can also be asked for 5 marks. So axilla, it is the muscular space which resembles the four-sided pyramid. So apex, it is directed upwards and medially towards the root of the neck. So in the apex, anteriorly it is formed by the posterior surface of clavicle, posteriorly superior border of the scapula and medial aspect of the coracoid process, and medially you have outer border of the first rib. And base or the floor, it is directed downwards, and it is formed by the skin superficial fascia and axillary fascia, and it is having 4 walls: anterior wall, posterior wall, medial wall, and lateral wall. Anterior wall is formed by the pectoralis major in front and clavipectoral fascia and pectoralis minor, whereas posterior wall is formed by the subscapularis in above and teres major and latissimus dorsi below. So, next slide. So in this image, you can see the four-sided pyramid-like structure. So apex is directed upwards towards the root of the neck, and medial wall, it is formed by the upper 4 ribs with the intercostal muscles and upper part of the serratus anterior muscle, whereas lateral wall is formed by upper part of the shaft of humerus and coracobrachialis and short head of the biceps brachii muscle. The contents of axilla are mainly axillary artery and its branches, axillary vein and its tributaries, infraclavicular part of the brachial plexus, axillary lymph nodes, and the long thoracic and intercostobrachial nerves, and axillary fat. Next. So in this image, you can see all the structures, all the contents of the borders and walls and contents of the axilla. This is the coronal section. So the medial wall, posterior wall, and anterior wall and lateral wall. In the center, you can see the axillary nerves and its branches, axillary artery and vein, and part of coracobrachialis and biceps brachii muscle. Next. So next, coming to scapular region. So it is having mainly supraspinatus, infraspinatus, teres major and minor muscle. Next. Supraspinatus origin from the medial two-third of the supraspinous fossa and inserted into the greater tubercle of the humerus. Infraspinatus medial two-third of infraspinous fossa and inserted into the middle part of the greater tubercle. And teres minor upper two-third of the dorsal surface, and it ends at the lower impression in the greater tubercle. Subscapularis arises from the medial two-third of the scapular fossa and inserted into the lesser tubercle of the humerus. And teres major origin from the lower one-third of the dorsal surface, lateral border and inferior angle of the scapula, and inserted into the medial lip of the bicipital groove of the humerus. Next. Supraspinatus and infraspinatus, they are supplied by the suprascapular nerve branch of brachial plexus, and they are responsible for the uh, movements. Mainly, it steadies the head of the humerus during the movement of the arm, and it also helps in the abduction of the shoulder up to 15 degree. And infraspinatus, it is the lateral rotator of the arm. Teres minor and infraspinatus both help in the lateral rotation of the arm. Subscapularis muscle supplied by the upper and lower subscapular nerves, and actions medial rotator and adductor of the arm. And there is major lower subscapular nerve, and it is responsible for medial rotation, adduction and extension of the arm. Next. So in this one more important muscle is deltoid. So deltoid muscle, it is multipinnate muscle. Next slide. So origin of the deltoid, it is from the anterior border and adjoining surface of the lateral one-third of the clavicle, and lateral border of the acromion process, where it forms four septa of origins, and also from the lower lip of the crest of the spine of the scapula. So it is inserted into the deltoid tuberosity of the humerus. It is supplied by the axillary nerve. It is multipinnate muscle, so actions. So multipinnate acromial fibers, the acromial fibers, they are powerful abductors of the arm, whereas anterior fibers are responsible for flexion and medial rotation, whereas posterior fibers, they are responsible for extension and lateral rotation. Next slide. So in this image, you can see The from acromion process, the four septas are formed. So they are the main powerful abductors, whereas anterior fibers responsible for flexion and medial rotation, whereas posterior fibers are responsible for extension and lateral rotation. Next. Next, coming to anterior compartment of the arm. So the main muscle in this is biceps brachii. So biceps brachii can be asked for 5 marks individual or altogether anterior compartment of the arm. Coracobrachialis, biceps brachii and brachialis muscle. Coracobrachialis, it is from coracoid process to the um, medial border of the humerus, that is middle 5 centimeter of middle border of the humerus, whereas biceps brachii, it is having two heads, long head and short head. Short head arises from along with the coracobrachialis from the lateral aspect of the coracoid process, whereas long head arises from next slide. Long head arises from supraglenoid tubercle, and it ends in the posterior rough part of the radial tuberosity, where the tendon is twisted, and further it gives off extension of the bicipital aponeurosis that you can observe in the cubital fossa. And brachialis muscle, it is arises from the lower half of the humerus in the anterior aspect, and it ends at the coronoid process of the ulnar coronoid process and ulnar tuberosity, and also to the rough anterior surface of the coronoid process of ulna. Next. So all the muscles, they are supplied by musculocutaneous nerve. So they are mainly flexion, responsible for the flexion of the forearm, whereas coracobrachialis does flexion of the arm at the shoulder joint. Biceps brachii mainly flexes the forearm, and brachialis flexes the forearm at the elbow joint. Next. So in this image, you can see coracobrachialis and short head of biceps brachii in between two muscles. So the musculocutaneous nerve is piercing. Next. So next important muscular space is cubital fossa. So boundaries are, so cubital fossa, it is triangular fossa present in front of the elbow in the anterior aspect. So boundaries mainly laterally by the medial border of the brachioradialis and medially by the lateral border of pronator teres, and base is directed upwards, and it is represented by imaginary line joining two epicondyles of the humerus, medial and lateral epicondyles of the humerus, whereas apex, it is directed downwards and formed by the area where brachioradialis crosses, and roof is formed by the skin superficial fascia, which contains a cubital vein where it joins the cephalic and basilic veins, deep fascia and bicipital aponeurosis, whereas floor is formed by brachialis and the supinator muscle. Next. Next, coming to contents of the um, cubital fossa. So mnemonics, you can use MBBR, that is median nerve, brachial artery, by tendon of the biceps brachii and radial nerve. So in the image you can see the brachial artery divides into two, radial and ulnar artery in the cubital fossa. So bicipital aponeurosis, median nerve and radial nerve. Next. Next. Next is posterior compartment. Triceps brachii muscle is also important muscle in the upper limb. So it can also be asked for 5 marks. So the origin, it has three heads: long head, lateral head, and medial head. Long head arises from the infraglenoid tubercle of the scapula. Lateral head arises from oblique ridge of the posterior surface of humerus, whereas medial head arises from large triangular area on the posterior surface of the humerus. It is inserted into the long and lateral heads. They fuse to form superficial flattened tendon and inserted into the superior surface of the olecranon process. And it is supplied by radial nerve. It is powerful extensor of the elbow. Long head, along with the extension, it also does adduction of the arm at the shoulder joint. Next. So in this image, you can see radial nerve and profunda brachia artery in the radial groove, along in between lateral head and medial head of the triceps brachii. Next. Next, superficial and deep muscles of the front of the forearm. Superficial muscles. Next. Superficial muscles. There are 5 superficial muscles: pronator teres, flexor carpi radialis, palmaris longus, flexor digitorum superficialis, and flexor carpi ulnaris. So they are having common origin, that is medial epicondyle of the humerus, and they are inserted. So pronator teres inserted into lateral aspect of the shaft of the radius. Flexor digitorum superficialis having two heads, humero-ulnar and radial head. So this muscle, it divides into 4 tendons, and each tendon they divide into 2 slips, and they are inserted into the middle phalanx of the second to fifth digits. Next. All the muscles are supplied by median nerve, whereas flexor carpi ulnaris is supplied by ulnar nerve. Action, mainly flexion of the forearm. Pronator teres is responsible, that is the pronator of the forearm, and others all are responsible for flexion. And flexor carpi radialis, along with the flexion, it does abduction at the wrist joint. And flexor carpi ulnaris, it adducts the hand at the wrist joint. Next. In the deep muscles, you have 3 deep muscles: flexor digitorum profundus, flexor pollicis longus, pronator quadratus. Flexor digitorum profundus, it originates from 3/4 of the anterior medial surface of the shaft of ulna and medial surface of the olecranon and coronoid process of ulna, and also anterior surface of interosseous membrane. And it inserts in the form of 4 tendons in the medial 4 digits, like in the flexor digitorum superficialis. In the same way, which enters the palm by passing through the deep flexor retinaculum. So opposite the proximal phalanx, corresponding digit, it perforates the tendon of the flexor digitorum superficialis, and each tendon of flexor digitorum profundus, it is inserted into the palmar surface of the base of the distal phalanx. Pronator quadratus, it arises from the oblique ridge and the lower one-fourth of the anterior surface of the shaft of ulna and the area of medial to it, and inserts into the superficial fibers in the lower fourth of the anterior surface and the anterior border of the radius. Next slide. So flexor digitorum profundus, it is supplied by the medially, it is supplied by ulnar nerve, whereas lateral half is supplied by the anterior interosseous nerve, and it is mainly responsible for the flexion of the distal phalanges, and it also flexes the joints of the fingers and the wrist. And flexor pollicis longus, it is mainly for the flexion of the thumb, and pronator quadratus, pronation, which pronates the forearm. Next. So intrinsic muscles of the hand, so total 20 muscles are there. So in the next slide. So intrinsic and extrinsic muscles of the hand, that is thenar eminence, having three muscles: abductor pollicis brevis, flexor pollicis brevis, and opponens pollicis. Opponens pollicis for the opposition action of the thumb to all the fingers, and flexor pollicis brevis, flexion of the thumb. Abductor pollicis brevis, it is the abductor of the thumb. Next, adductor of the thumb, that is adductor pollicis, which is responsible for the adduction, that is joining of the other fingers. Abduction is separation of the fingers. And next, muscle of the medial side of the palm, that is palmaris brevis. It is responsible for which wrinkles the skin to improve grip of the palm. Next, muscles of hypothenar, that is in front of the little finger, abductor digiti minimi, flexor digiti minimi, and opponens digiti minimi. Abductor digiti minimi is responsible for abduction of the uh, little finger, that is separation from the other fingers. Flexion of the little finger, and opponens, that is opposition action uh, to touch the other all four fingers. And lumbricals, four lumbricals are there. Next, four lumbricals, four palmar interossei and four dorsal interosseous are there. So they are mainly responsible for lumbricals. They flex the metacarpophalangeal joints, whereas palmar interossei, they abduct the fingers towards the center, and dorsal interossei, they abduct the fingers from center to the third digit, that is towards the middle finger, and away from the middle finger, that is uh, abduction, adduction towards the middle finger. Next, back of the forearm and hand. So you have extensor muscles of the forearm. Next, Anconeus brachioradialis, extensor carpi radialis longus, and extensor carpi radialis brevis, extensor digitorum, extensor digiti minimi, extensor carpi ulnaris. These are the seven superficial four extensor muscles. The common origin is lateral epicondyle of the humerus. They are mainly supplied by radial nerve, whereas extensor carpi radialis and digitorum and digiti minimi, extensor carpi ulnaris, they are all supplied by the deep branch of the radial nerve. Action mainly extension of the elbow joint and abduction at the wrist joint. That is extensor carpi radialis and brevis, they abduct the wrist joint, and also extensor carpi ulnaris helps in the adduction of the wrist joint. Next, and deep muscles of the back of the forearm, supinator, abductor pollicis longus, extensor pollicis brevis, extensor pollicis longus, and extensor indicis. So supinator mainly arises from the lateral epicondyle. Next slide. Whereas all other they arise from the posterior surface shaft of the radius, that is abductor pollicis longus and extensor pollicis brevis. Whereas extensor pollicis longus and extensor indicis, they arise from the posterior aspect of the ulna. So they are mainly responsible for the supination of the forearm, supinator, whereas the abductor pollicis is abduction and it extends the thumb. Extensor pollicis brevis extends the metacarpophalangeal joint of the thumb. Extensor pollicis longus, extension of the digital phalanx of the thumb. And extensor indicis, it extends the metacarpophalangeal joint of the index finger. Next slide. Next. Next. So we finished the upper limb muscles. So next coming to muscles of the thoracic region, mainly three muscles: internal intercostal muscle, external intercostal muscle, and transversus thoracic muscle. So external intercostal muscle from the lower border of the rib and inserts into the outer lip of the upper border of the corresponding rib. So it is directed downwards and medially, whereas internal intercostal, it arises from the floor of the costal groove of the rib and it inserts into the inner lip of the upper border of the corresponding rib, and they are directed downwards and laterally. Transversus thoracis, it arises from the inner surface of the rib and middle 2/4 of the ridge above the costal groove and inserts into the inner surface of 2 or 3 ribs below inner lip of upper border of the rib below and costal cartilages of second to sixth ribs. So the main action of intercostal muscles is they are mainly responsible for the respiration, and they help in the maintaining the intercostal space. They help in not collapsing the space between the intercostal space. So they help steadying the ribs. And during respiration, some expulsive actions like coughing, sneezing, and all. Next slide. Next slide. So next coming to muscles of the lower limb. So in the front of the thigh, next slide, you have sartorius. Sartorius is the longest muscle. So it can be asked for MCQ. And quadriceps femoris. Quadriceps femoris is important muscle. This can be asked for 5 marks. Individual, uh, which is having four parts: rectus femoris, vastus lateralis, vastus medialis, and vastus intermedius. And articular genu is a small muscle. Quadriceps femoris is important muscle in the anterior aspect of the thigh. It is main next slide. It is mainly supplied rectus femoris muscle, vastus lateralis. There's all these are supplied by the femoral nerve. They are mainly extensors of the knee. So it is the rectus femoris is also called as kicking muscle. Vastus lateralis, it extends the knee joint, helps in the standing and walking. And whereas vastus medialis extends knee joint, prevents lateral displacement of the patella. And vastus intermedius also helps in the extension of the knee joint. Sartorius muscle, it is also supplied by femoral nerve, and it is main abductor and lateral rotator of the thigh. It also helps in the flexion of the leg at the knee joint. Next, important muscular space in the lower limb is in the thigh is femoral triangle. So boundaries. So it is mainly by the uh, medial border of the sartorius muscle and lateral border of the adductor longus muscle, whereas superiorly floor superiorly it is having inguinal ligament, so forming the triangle. Roof is formed by skin superficial fascia, which is containing superficial inguinal lymph nodes, femoral branch of the genitofemoral nerve, branches of ilioinguinal nerve, superficial branches of the femoral artery, and upper part of the great saphenous vein. Deep fascia, including cribriform fascia, which is covering the saphenous opening. And the floor, it is mainly formed by medially by the adductor longus and pectineus, and laterally by the psoas major and iliacus. In the image, you can see iliacus and pectineus muscles. The contents of the femoral triangle are femoral artery and its branches, femoral vein and its tributaries, the femoral sheath, femoral nerve and branches, deep inguinal lymph nodes. So in the image, you can observe the that is presence of the mnemonic is van, that is vein, artery, nerve. The arrangement of the content is like vein, artery, and nerve. So that is femoral vein, femoral artery, and femoral nerve and its branches. And towards and near the femoral vein above and below. You can in the below you can see in the above you can see deep inguinal lymph nodes. They are also one of the content of the femoral triangle. Next, next is medial compartment of the thigh. It is also called as adductor compartment of the thigh. So mainly having five muscles: adductor longus, adductor brevis, adductor magnus, gracilis, and pectineus. Next slide, next slide. So adductor longus, it is triangular muscle which arises from the flat tendon from the body of the pubis. Pubic crest and pubic symphysis, and inserts into the linea aspera in the middle one third of the shaft of the femur. Adductor brevis in the anterior surface of the body of the pubis, outer surface of the ramus of the ischium, inferolateral part of ischial tuberosity, and lower part of inferior ramus, inserted into the line extending in the lesser trochanter, that is in the to the upper part of linea aspera. Adductor magnus, it arises from the inferolateral part of ischial tuberosity, ramus of the ischium, and lower part of inferior ramus of the pubis, and inserted into the gluteal tuberosity, that is medial aspect of the gluteal tuberosity, linea aspera, medial supracondylar line, and adductor tubercle. So the adductor compartment may be asked for 5 marks. Next slide. So these are mainly responsible for these are the powerful adductors of the thigh at the hip joint. Adductor longus, brevis, and magnus. Whereas gracilis and pectineus, gracilis performs flexion and medial rotation of the thigh, and pectineus flexion and adductor of the thigh. So pectineus is a hybrid muscle having two nerve supply, double nerve supply, that is femoral nerve as well as obturator nerve, anterior division of the obturator nerve. Next, gluteal region. So in the gluteal region, you have a total of 10 muscles. Main important muscle in this region is gluteus maximus. So it is the largest muscle which almost covers the gluteal region. Large quadrangular and powerful muscle. So origin of this muscle is from outer slope of the dorsal segment of iliac crest, posterior gluteal line, posterior part of the gluteal surface of the ilium, aponeurosis of erector spinae, dorsal surface of lower part of sacrum, sacrotuberous ligament, and it is inserted into the deep fibers inserted into the gluteal tuberosity, whereas most of the part is inserted into the iliotibial tract. So gluteus muscle, it is mainly supplied by inferior gluteal nerve, and main actions is it is the extensor of the thigh at the hip joint, chief extensor. So this muscle is very important from sitting position, that is standing from the sitting position. It is also lateral rotator of the thigh, abduction of the thigh, and along with the tensor fasciae latae, this muscle also stabilizes the knee through the iliotibial tract. So that is why if any paralysis of gluteal maximus is there, then the person cannot stand. And gluteus medius and minimus together, they are powerful abductors of the thigh, whereas piriformis, gemellus superior, gemellus inferior, obturator internus, quadratus femoris, obturator externus, these all are the lateral rotators of the thigh at the hip joint, whereas tensor fasciae latae, it helps in the abduction and medial rotation of the thigh and extension of the knee joint. So single gluteus maximus can be asked for 5 marks. In that, you can also write the structures under the gluteus, important structures under the gluteus maximus muscles, maximus, that is muscles like gluteus medius, minimus, and all, and bones, ilium, ischium. And the nerves in gluteal vessels and nerves. Next slide. Next. Next slide. So next is popliteal fossa. This is also one of the muscular space which is present behind the knee boundaries. Superolaterally, the biceps femoris. Superomedially by the semitendinous and the semimembranous muscle. And inferolaterally, lateral head of the gastrocnemius. And inferomedially, medial head of the gastrocnemius. Roof is formed by the deep fascia or the popliteal fascia, and floor is formed by the popliteal surface of the femur, capsule of the knee joint, and strong popliteal fascia covering the popliteus muscle. Contents: popliteal artery and its branches, popliteal vein and its tributaries, tibial nerve and its branches, common peroneal nerve and its branches, posterior cutaneous nerve of thigh, genicular branch of obturator nerve, popliteal lymph nodes, and fat. Next. So you can see diamond shape fossa in behind the knee joint, superiorly formed by the semitendinous superolaterally by the biceps femoris and medially by the semitendinous and semimembranous, and inferiorly by the plantaris and medial head of the gastrocnemius. So content, the arrangement of content in the popliteal fossa. In the superior aspect, a artery, vein, and nerve. whereas in the middle and lower aspect, excuse me. Next, muscles of the back of the thigh. So back of the thigh muscles, they are also called as hamstring muscles, mainly contain semitendinous, semimembranous, biceps femoris, and adductor magnus muscle. So hamstring muscles, they are commonly asked for 5 marks. So semitendinous muscle originates from the medial impression on the ischial tuberosity and inserts into the medial surface of tibia behind the sartorius. So it has a long tendon of insertion. Semimembranous, it is having flat tendon origin, that is why it is called as semimembranous. It originates from the superolateral impression and of the upper part of the ischial tuberosity and inserts into the medial condyle of the tibia, that is posterior aspect of the medial condyle of the tibia. And next is biceps femoris. So biceps, that is having two heads, long and short head. Long head arises from the inferior aspect of the upper part of ischial tuberosity, whereas short head arises from the lateral lip of linea aspera in between adductor magnus and vastus lateralis. And they are inserted in biceps femoris inserted into the tendon. It folds around and by the fibular collateral ligament, and it is inserted into the head of the fibula. Adductor magnus muscle, it is the largest muscle of this compartment. It arises from lower part of the ischial tuberosity, ramus of the ischium, and lower part of inferior ramus of the pubis, and inserted into the medial margin of the gluteal tuberosity, linea aspera, medial supracondylar line, and adductor tubercle. Nerve supply, mainly supplied by the tibial part of the sciatic nerve, semitendinous and semimembranous muscles, and they are main flexors of the knee and medial rotators of the leg when semi-flexed knee is there. Whereas biceps femoris, long head is supplied by tibial part of the sciatic nerve, whereas short head supplied by the peroneal part of the sciatic nerve. And these are the chief flexor of the knee and lateral rotator of the leg. Adductor magnus, it is having two nerve supply, so that is it is also hybrid muscle. So adductor part of it is supplied by posterior division of the obturator nerve, whereas hamstring part by the tibial part of the sciatic nerve. Next, and it is mainly adduction of the thigh. It helps in the adduction of the thigh. Next, muscles of the anterior compartment of leg and dorsum of the foot. So this mainly extensor digitorum longus, tibialis anterior, and extensor hallucis longus, and peroneus tertius muscle, and extensor digitorum brevis. 5 muscles are there. So these are the anterior compartment of leg. These are mainly responsible for, they are mainly supplied by the deep peroneal nerve, and tibial is anterior. It helps in the dorsiflexion of the foot and inversion of the foot. whereas extensor hallucis longus helps in the dorsiflexion of the foot and extension of the metacarpophalangeal and interphalangeal joints. Extensor digitorum longus, dorsiflexion and extension of the metatarsophalangeal and proximal and distal interphalangeal joints. And peroneus tertius, it also acts as a dorsiflexion of the foot and everter of the foot. And extensor digitorum brevis, it does extension of the hallucis, that is the big toe, extension of the metatarsophalangeal joints. So all these are supplied by the deep peroneal nerve, whereas extensor digitorum brevis is supplied by the lateral terminal branch of the deep peroneal nerve. Next, next slide. Next, peroneal muscles. So two peroneal muscles are there, that is peroneus longus and peroneus brevis. Peroneus longus, so mainly from the head of the fibula and posterior aspect of the shaft of fibula, and peroneus brevis in the anterior half and middle half of the lateral surface of fibula, and anterior posterior intramuscular septum of the leg. So these peroneal muscles, they are mainly supplied by superficial peroneal nerve. Peroneus longus, it is the elevator of everter of the foot, and it also maintain the lateral longitudinal arch and transverse arch of the foot. Whereas peroneus brevis, it is everter of the foot. Next. So in this image, you can see peroneus longus and brevis. Back of the leg. So back of the leg muscles, that is important muscles. They are also called as calf muscles. Gastrocnemius, soleus, and plantaris. So gastrocnemius muscle, large muscle, which are having two heads, medial head and lateral head. Medial head arises from the posterior superior depression on the medial condyle of the femur and capsule of the knee joint, and lateral head arises from the broad flat tendon from lateral surface of the lateral condyle of the femur and capsule of the knee joint, and they are inserted into the tendon of this muscle. It fuses with the tendon of soleus to form the tendocalcaneus, that is Achilles tendon. Next is soleus muscle. It is sole shaped, that is why named soleus. It originates from the fibula, back of the head and upper 1/4 the posterior surface of the shaft, and from tibial aspect, soleal line and medial 1/3 of the shaft, medial border of the shaft, and tendinous soleal arch between tibia and fibula. So both the gastrocnemius and soleus, they fuse the tendon to form the Achilles tendon in the back of the leg in the lower aspect behind the ankle. And next, plantaris muscle. So it is vestigial in human. It originates from the lower part of the lateral supracondylar line of the femur and oblique popliteal ligament. And its tendon is thin and long. So in between gastrocnemius and soleus, it crosses from lateral to medial side. Next slide. So all these muscles, they are supplied by the tibial nerve. Gastrocnemius and soleus, they are the strong plantar flexions of the foot at the ankle joint. And soleus is more powerful in walking and all. So all the deep muscles of the next is deep muscles of back of the leg. So having four muscles: popliteus, flexor digitorum longus, flexor hallucis longus, and tibialis posterior. All these are supplied by tibial nerve, and the popliteus mainly helps in the unlocking the knee joint. Flexor digitorum longus mainly flexes the distal phalanges and plantar flexion at the knee joint, ankle joint. And flexor hallucis longus, it flexes the phalanx of the big toe. And tibialis posterior, it helps in the plantar flexion of the ankle joint and inversion of the foot at subtalar talar joint. Next, muscles of the sole. So it is divided into four layers. In the first layer, you have abductor hallucis, abductor digiti minimi, and flexor digitorum brevis. So mainly abductor hallucis responsible for the abduction of the big toe, abductor digiti minimi responsible for abduction of the little toe, and flexor digitorum brevis mainly for the flexion of the digits and phalanges and metatarsal joints. Layer In the layer 2, you have flexor digitorum accessoris and tendon of flexor hallucis longus, tendon of flexor digitorum longus, and lumbrical muscles, four lumbrical muscles. And in the layer 3, you have tendon of tibialis posterior, long plantar tendon of peroneus longus, oblique and transverse heads of the adductor hallucis, flexor digiti minimi brevis, and flexor hallucis brevis. Whereas in the fourth layer, only four plantar introsseous are there. Next, next. So this completes the lower limb muscles. Next is important abdominal muscles. So abdominal muscles, there are four abdominal muscles: external oblique, internal oblique, transverse abdominis, and rectus abdominis. Next, external oblique muscle origin from the eight fleshy slips from the outer surface of middle shaft of lower eight ribs and insert as a broad aponeurosis into the from above downwards xiphoid process, linea alba, pubic symphysis, pubic crest, and pectineal line of the pubis. Nerve supply, that is lower six thoracic nerves. So these abdominal muscles, whole of the can be asked for 5 marks, or individual abdominal muscles also can be asked for 5 marks. So you have to write origin, insertion, nerve supply, and actions, and also with the diagram. Next is internal oblique. The fibers of the internal oblique, they run upward, forwards, and medially. Origin from the lateral two-third of the inguinal ligament, anterior two-third of the intermediate area of iliac crest and thoracolumbar fascia. Whereas upper fibers, they are inserted directly into the lower three or four ribs, The great part of this muscle inserts in as aponeurosis inserted into the seventh, eighth, and ninth costal cartilages, xiphoid process, linea alba, pubic crest, and pectineal line of the pubis. And nerve supply, lower six thoracic nerves. Next is transversus abdominis, origin from the lateral one third of the inguinal ligament, anterior two third of the inner lip of the iliac crest, thoracolumbar fascia, and inner surface of the lower six costal cartilages, and inserted into fibers. They end in broad aponeurosis, and they inserted into the xiphoid process, linea alba, pubic crest, and pectineal line of the pubis. Whereas lower fibers diffuse with the lower fibers of the internal oblique to form conjoint tendon, and it is supplied by lower six thoracic nerve as well as first lumbar nerve. Whereas rectus abdominis muscle, it runs vertically upwards, so arises from the lateral head, from lateral part of the pubic crest, and medial head is from the medial part of pubic crest, and inserted into the wall of the thorax along the horizontal line, that is passing laterally from the xiphoid process and in the order, that is 7th, 6th, and 5th costal cartilages, and it is supplied by the lower 6 thoracic nerves. Next. So main functions of abdominal muscles is mainly it covers all the visceras, and they help in the ex, expulsive movements like defecation, urination, parturition, vomiting, and all, and forceful expiration movements like coughing, sneezing, and all. Next, diaphragm. So diaphragm is the muscle which divides the abdomen and thoracic cavity. So origin, it is from the three parts: sternal part, costal part, and lumbar part. Sternal part from the slips from the back of the xiphoid process, and costal part from the inner part of the cartilages and adjacent part of lower six ribs, and lumbar part from the medial and lateral lumbocostal arches and from the lumbar vertebrae, and they insert as the central tendon of the diaphragm. So before that, they form medial lumbocostal arch, that is arches, medial lumbocostal arch and lateral lumbocostal arch, right and left crus, and medial margin, that is two crura, tendinous arc across the aorta. Nerve supply is by the motor is by phrenic nerve, sensory by the sensory phrenic nerve, that is central part of the diaphragm, and lower six thoracic nerve supplied to the peripheral part of the diaphragm. So this muscle fiber, it forms a dome-like arch, and the right dome is higher than the left dome. The central tendon, it lies at the level of sixth costal cartilage. So right dome, it is little high. It reaches up to the whenever expiration, full expiration, during full expiration, it reaches up to fourth intercostal space, whereas left dome, it reaches up to fifth rib. So this insertion as the central tendon of the diaphragm. It the ten this ten, central tendon of the diaphragm, it is trilobar in shape, having three leaflets. Middle leaflet is triangular, whereas right and left leaflets are tongue shaped. The main action of diaphragm muscle is It is the main principal muscle of the inspiration, and expulsive acts like sneezing, coughing, laughing are performed by it, and sphincteric action in lower end of the esophagus, mainly due to contraction in the intrinsic muscle. And there are some openings in the diaphragm muscle. The main major openings are three, that is vena cava opening, esophageal opening, and aortic opening. So vena cava, so you can remember 8, 10, and 12. At the vertebral level of 8, thoracic vertebra, vena cava opening is there. At the 10th vertebral level, you have esophageal opening, and at the 12th, aortic opening. Next, muscles of the posterior abdominal wall. So mainly four muscles: psoas major, psoas minor, iliacus, and quadratus lumborum. Psoas major muscle is important muscle here. So it originates from anterior surface and lower border of transverse process of all lumbar vertebrae, and it forms five slips, each one from the bodies of two adjacent vertebrae, and from four tendinous arches extending across the constricted part of bodies of the lumbar vertebra. And it is inserted into the muscle. It is inserted in behind the inguinal ligament and in front of the hip joint. It enter to enter the thigh, and it inserted into the tip and medial part of the anterior surface of lesser trochanter of the femur. So all these muscles, they are mainly supplied by the spinal nerve, lumbar spinal nerves. So psoas major mainly supplied by the spinal nerve L2, L3, and sometimes L4, whereas psoas major supplied by the L1 branch, and iliacus branches from the femoral nerve, and quadratus lumborum ventral rama of the spinal nerve. Actions. So psoas major along with the iliacus, it acts as the powerful flexion of the hip joint, and it mainly helps in the stabilizing the hip, balances the trunk, and it is a weak medial rotator of the hip. Whereas quadratus lumborum, it flexes the last rib during inspiration. Next, perineal muscles. Three perineal muscles: ischiocavernous, bulbospongiosus, and superficial transversus perineae. So ischiocavernous supplied by the perineal branch of the pudendal nerve, and it helps in the maintaining erection of the penis. And bulbospongiosus supplied by the perineal branch of the pudendal nerve. It helps in the ejaculation of the semen. And middle fibers, they are mainly erection of the corpus spongiosum, spongiosum of the penis. And anterior fibers helps in the erection of the penis by compressing the deep dorsal vein of the penis. And superficial transversus perineal muscle, it is also supplied by perineal branch of pudendal nerve. It steadies the perineal body. And other in the females, the perineal muscles, that is external muscles, muscles of the female reproductive system, that is labia majora, minora, they all form vulva, so they can also be included in the perineal muscles. Next, muscles of the head and neck. So the facial muscles, you have muscles of the eyelid, corrugatus supercilii, and orbicularis oculi muscle. They are mainly responsible for the protection of the eye, and muscles around the nasal opening, procerus, compressor nares, dilator nares, and depressor septi. Procerus, it does transverse wrinkles. Compressor nares, it helps in nasal aperture, compression of the nasal aperture, whereas dilator nares and dilation of the nasal aperture, and depression septi responsible for the nose. Nose is pulled inferiorly. And next, muscles around the lips, orbicularis oris and buccinator. Buccinator is the whistling muscle. This can be asked for MCQs. Orbicularis oris surrounding the mouth. It helps in the closing the lips and protruding the lips. Buccinator, it flattens the cheeks against the gum. So it is also called as whistling muscle. And levator labii superioris, zygomaticus major muscle. Levator labii superioris, it mainly helps in the elevation of the upper lip. Levator anguli oris elevates the angle of the mouth from and forms the nasolabial groove. Next, zygomaticus minor, depressor anguli oris, depressor labii inferioris, mentalis muscle is mainly responsible for the elevation and protrusion of the lower lip, and it also wrinkles the skin of the chin. And muscles of the neck, mainly platysma, that is very thin and long muscle in the neck. It releases pressure of the skin on the subjacent veins and pulls the angles of the mouth downwards, like in frighting action. So coming to important spaces in the neck, that is triangles of the neck. So there are anterior triangle and posterior triangle. Posterior triangle is having two triangles, occipital part and supraclavicular part, that is formed by the sternocleidomastoid muscle and platysma laterally, and below by the inferior belly of the omohyoid. Whereas supraclavicular part above by the inferior belly of the omohyoid and below by the clavicle. And next, anterior triangles. Mainly four triangles are there: submental triangle, digastric triangle, carotid triangle, and muscular triangle. So submental triangle, it is in the median aspect. So the anterior triangle, it starts from the medial aspect, from the chin, lower aspect of the chin to the sternum, and laterally to the medial border of the sternocleidomastoid muscle, and in the superiorly from the center of the chin to the mastoid process, the imaginary line drawing there. So in the image you can see submental triangle. The contents of submental triangle are four submental lymph nodes, central part of the and small submental veins. Digastric triangle, It is having so it is the area between mandible and the hyoid bone, that is submandibular region. So boundaries of the digastric triangle are anterior-inferiorly anterior belly of the digastric muscle, posterior-inferiorly posterior belly of the digastric and the stylohyoid, superiorly mandible, and roof is formed by the skin superficial fascia. Floor is formed by the mylohyoid muscle and contains in the anterior aspect it has superficial part of the submandibular salivary gland, submental artery, mylohyoid nerve and vessels, hypoglossal nerve. In the posterior aspect, you have parotid gland, deep structures like styloglossus, stylopharyngeus, and it also include internal carotid artery and internal jugular vein. Next, carotid triangle. The boundaries of the carotid triangle, they are formed by posterior belly of the digastric muscle and stylohyoid, and anterior-inferiorly superior belly of the omohyoid, posteriorly by the anterior border of the sternocleidomastoid. Roof is formed by the skin and superficial fascia. So main contents, floor is formed by medial constrictor of pharynx. The main contents of carotid triangle are mainly common carotid artery, internal carotid artery and external carotid artery. Veins, internal jugular vein, common facial vein, pharyngeal vein and lingual vein. It includes nerve branches of vagus nerve running downwards through the carotid triangle, superior laryngeal branch of the vagus, and spinal accessory nerve running downwards towards the internal jugular vein over the and hypoglossal nerve running forwards and sympathetic chain and carotid sheath. And next is muscular triangle. The boundaries of the muscular triangle is anteriorly by the median line of the neck of the hyoid bone and posterior superiorly by the superior belly of omohyoid muscle and posterior inferiorly lower part of the anterior border of the sternocleidomastoid muscle. The main content is it contains infrahyoid muscles like sternohyoid, sternothyroid, thyrohyoid, and omohyoid muscles. Next, next slide. So these are suprahyoid, digastric, stylohyoid, mylohyoid muscles. Next, next. So these are the infrahyoid muscles. The main contents of the muscular triangle, that is sternohyoid, sternothyroid, thyrohyoid, and omohyoid. Next. So in this image, you can see the sternothyroid from sternum to the thyroid, thyrohyoid from sternum. Next. And other three infrahyoid muscles are geniohyoid, hyoglossus, and genioglossus muscle. Next. So next, muscles of mastication. So this is important. They are mainly usually asked for 5 marks. Mainly, it contains masseter muscle, temporalis muscle, and medial and lateral pterygoid muscle. So the masseter muscle is responsible for elevation of the mandible and and protrusion. The superficial fibers of this cause protrusion. And temporalis muscle, it elevates the mandible and helps in grinding movement. So in this image, next you can see origin and insertion of the masseter, masseter muscle and all other muscles of the mastication. Lateral pterygoid and medial pterygoid. Lateral pterygoid muscle, it depresses the mandible. It helps in the opening of the mouth and protrudes the mandible. And medial pterygoid, it elevates the mandible, helps in protruding the mandible. Next, some of the prevertebral muscles like longus colli, longus capitis, rectus capitis anterior, rectus capitis lateralis. These all help in the flexion of the head. Next, so here you can see all the scalenus muscles as well as prevertebral muscles. Scalenus muscles, that is lateral aspect of the neck, and some of the muscles of the back along with the trapezius, latissimus dorsi and all. So serratus posterior superior, serratus posterior inferior, splenius having two parts, cervicis and capitis. So these all help in the uh, keeping the back in the postural aspect. Next, next slide. Next slide. Next slide. So muscles of the back, in this image you can see in the first layer you can see trapezius, latissimus dorsi, rhomboides major, minor and levator scapulae. In the second layer you have levator scapulae, rhomboides major, minor. Sorry. Splenius capitis and splenius cervicis. Next. And some other along with this, some other in the third layer you can see longissimus cervicis, longissimus thoracis, longissimus lumborum and directus spinae muscles, and spinalis thoracis, iliocostal thoracis, iliocostal cervicis muscles, and also multifidus muscle. So these all come under third layer of the back muscle. Next. So these all are postural muscles. They help the they connect the pelvic girdle and whole of the spine and keeping the erection of the spine, erecting the spine, extension, that is normal anatomical position. Next, scalenus muscles, that is lateral aspect of the neck, scalenus anterior, scalenus medius and posterior. So they are mainly responsible for flexion and lateral flexion of the head, that is cervical spine, head and neck region. Next. Next. Next, suboccipital muscles. They are back of the neck muscles below the occipital area. So rectus capitis posterior major, rectus capitis posterior minor, obliquus capitis superior and obliquus capitis inferior. They are responsible mainly for the postural maintaining. They maintain the posture and helps in the extending and flexion of the head. Next. So in the next last slide. So in the syllabus, we see in the muscles, the movement of the muscles in yogasana, all the syllabus points explained in that context. So mainly whenever yogasana movement, muscular movement is there, there are mainly three contractions, that is isotonic contraction, concentric contraction, and eccentric contraction. Isotonic contraction, where nothing, what the tone of the muscle is changes, the length doesn't change. So functionally, the type of contraction used in the body to stabilize the things, that is the isotonic contraction. Like in high plank, for making that posture, so doing the movement when there is a isotonic contraction, so there will not be any increase in the length of the muscle, only muscle tone is changed. Next is concentric contraction. So here in this, the length of the muscle changes, that is at the macro level. Okay, the overall length of the muscle, it gets shorter for the concentric contraction. Okay, so for example, whenever you're flexing the elbow joint, so the biceps femoris, it shortens to flex the forearm. So, for example, in yoga, when you're doing Surya Namaskar, or you're extending hand, uh, when you're saluting the sun, so all the you're lifting the arms, so you're shortening the muscles. So that is the concentric contraction. And next is eccentric contraction. That is, in this type of contraction, there will be muscle length also changes, where it gets longer during in the eccentric, whereas in concentric, shortening of the muscle length is there, whereas in the eccentric, long the muscle length becomes long. That is like in forward, folding forward of the, that is flexing of the knee, for example. So hamstring muscles are they are the length of the hamstring muscles little, they become long to resist that movement. So these are three types of contractions where you can see during the yogasana. Okay, thank you. Any doubts are there? You can ask now.
Thank you, ma'am. Thank you for such an elaborative and knowledgeful session on myology. We have got few questions, ma'am, and
Okay,
I will be reading that up to you.
okay.
Ma'am. The first question is, will cuboidal fossa be asked in practical or theory?
We don't, because in some of the question papers in preparatory, they have asked these muscular spaces also, like femoral triangle and all. So you have to read for theory as well. They may ask for 5 marks. That is why I have included in this. They are mostly asked for 5 marks. Cubital fossa, femoral triangle, axilla, and popliteal fossa and all.
Thank you, ma'am. The next question is, ma'am, should we study the origin and insertion, action, and nerve supply of facial muscles?
Of
Facial muscles.
facial muscles. Um, Actually, they are facial muscles. There are so many muscles. Till now, usually facial muscles are not asked in the theory exams. Usually, during practical exam or viva, uh, we asked actions of the facial muscles and all. So mainly for your knowledge, you have to read, but mainly remember the actions and specialized muscle like buccinator, whistling muscle. So such muscles, they are asked for the MCQs because they are having special functions. So such things you have to remember. They can be asked for MCQs. They may not come for 5 marks.
Thank you, ma'am.
Okay.
Thank you, ma'am. And the next question is, ma'am, how to what all should be included if a question from biology is asked for 10 mark or 5 mark? Like what are
The
the
10 mark
contents?
question is impossible. Long question is no, it will not come from muscles. Uh, because
Yes, ma'am.
myology, peshi sharira, and keshadanta naka all together you have 11 marks. So they have to divide among all three. So usually muscle will be for 5 marks. Any one muscle or group of muscles like important muscle groups like hamstring muscles, calf muscles, abdominal muscles, and anterior compartment, and especially back muscles, individual muscles like trapezius, latissimus dorsi, and gluteus maximus. Such important muscles, they are asked for 5 marks. So
Yes, ma'am. Thank you, ma'am. Thank you for all the answers, ma'am. And one last question from our side, ma'am. What advice you would like to
yes,
give for the exam going students to face the exam bravely and to write it despite the outcome, despite the results, and
yes,
not to
yes.
worry about results and what advice or suggestion you would like to give them regarding exam, ma'am?
Yes. As anatomy is very tough subject, it is like chemistry, very volatile. So whenever you study, you imagine it in your body so that you can remember very easily. So like for example, whenever you read any novel, so you will be imagining the things, right? The person in the novel or like, so in the same way, whenever you are reading any region, any organ, so you imagine that in your own body and feel that, and then you will remember the things very easily, and you can by reading like that, so your effort will be fruitful because you can remember easily, and you can your time will be saved during your examination. You you can save the time during writing, and do not make any stress. Read smartly rather than all whole of reading. Give importance to the main first upper in this myology portion. Upper limb and lower limb muscles are mainly important, and thorax abdominal muscles, so they are mainly for 5 marks or MCQs, and others muscles little importance. And don't stress, read calmly, and whatever you read, you read with will, so you can remember all the things. Okay. So I thank Jignasa team for identifying me and giving this opportunity to um, have a part of this Ayur anatomy series. Thank you very much. I also thank my friend who has referred me, Dr. Pavitra, for referring me to the Jignasa. And thank you, Team Jignasa.
Thank you, ma'am. Thank you, ma'am. Actually, we would like to extend our warmest gratitude and thanks to you, ma'am, for agreeing on such a short notice. And despite all the health conditions and academic schedule, You agreed to deliver a session for us and to be a part of this
Yeah, it
journey
was
where
very
we want.
vast topic actually.
Yes, ma'am.
A whole
Yeah,
muscular system of the body to cover it in within short time. It is very difficult actually. So I have tried my level best. I don't know how it was, but I
ma'am.
thank the team for giving the opportunity.
Thank you, ma'am. Ma'am, we have got another two questions. Ma'am,
Okay.
the questions are, ma'am, what results can be expected as question, ma'am? That's the first question.
What?
What muscles can be expected as questions? Like what we can expect for exams?
Which all muscles?
Yes, ma'am.
So that's why I told in the upper limb you have biceps femoris, triceps femoris, and pectoralis major as a single individual muscle, and trapezius and latissimus dorsi, serratus anterior, and group of muscles like maybe anterior compartment and pectoral region. And in the lower limb, biceps femoral, quadratus femoris as a whole muscle that can be asked for 5 marks, and sartorius muscle, and compartment like hamstring muscles and calf muscles. They are hamstring muscles are commonly asked for 5 marks, very commonly asked, and these muscular spaces like axilla, um, popliteal fossa, femoral triangle, and cubital fossa. They are also they can also be asked. And in the head and neck region, muscles of mastication are very important. All muscles of mastication can be asked for 5 marks. And anterior triangles of the neck.
Thank you, ma'am. The next question is, since these intro topics are more asked in physiology, can we expect any questions as such other than description of one particular muscle?
Like see types of muscles. They can be for MCQs. What are the types of muscles? Filaments. It maybe it is deep, but sometimes they may ask for which all myofilaments are there in muscle muscle fiber, and types of muscles and scales. Main features, you can remember only main features of skeletal, cardiac, and smooth muscles like striations, nucleus, where it is present. For MCQs, they may ask. And in MCQs, you can also expect some questions like which is the longest muscle of the body, which is the largest muscle, longest muscle, sartorius, and gluteus maximus, largest, like that. And special muscles like buccinator is a whistling muscle, latissimus dorsi is climbing muscle. So such things they can ask for MCQs, which has a specialized function.
Thank you, ma'am. Thank you, ma'am. And we would
Okay.
like to thank you again for to being a part of this wonderful journey, ma'am, and to in our mission to help the first year exam writing students. Thanks for being a part, ma'am, and we would like forward to collaborate you in future also for various sessions and conferences which would help the Ayurveda students in as a whole, ma'am.
Okay.
Thank you, ma'am.
Sure. Thank you, Team
Thank you. I
Jitnesa.
request your permission to end the session.
Okay.